Hi, good morning, everyone. My name is Rhonda Robertson, and I will be presenting my case conceptualization today. The inspiration for my paper comes from a movie that's on Netflix called To the Bone. The movie is about a girl who is suffering from anorexia. Ellen is a 20-year-old European American female who has come in for counseling. She is accompanied by her stepmother, Susan, for support. Her father had planned to come but was unable to make the appointment due to his work obligations. Ellen agreed to come into counseling to get help with the stress she's feeling from her final exams. Ellen has been in counseling before, but recent events have prompted her to come in today. Ellen fainted during a lab practicum while attending her biology class. Her father and stepmother felt it was important to see a therapist. The initial reason for the visit is that Ellen fainted, but according to her stepmother, Ellen is demonstrating some dangerous behaviors as well. In addition to the fainting spell, Ellen has lost a significant amount of weight over the last month. She's also claimed that not to have an appetite and refuses to eat. Ellen insists that she is okay and that her parents are overreacting about her fainting. However, she does admit she has been very stressed at school. Her continued attempt to lose weight, lack of appetite, and recent fainting incident motivated Ellen's parents to make this appointment for her. Susan, her stepmother, says that Ellen skipped breakfast the morning she fainted, and maybe that has something to do with it. Ellen reiterates again that she is fine and denies having any problems with eating or her appetite. Additionally, Ellen admits that her only complaint is that she hates the way she looks and is too fat. She believes that if she could lose a few more pounds, she would be happy. Ellen has not had her menstrual cycle in a few months and reluctantly admits that her periods are less regular than they have been. She started her menses at the age of 13, and over the last 6 months, she has only had 2 periods. Ellen's parents divorced after having difficulties in their marriage. When Ellen was 16 years old, her mother had a severe and several psychotic episodes, which resulted in her being hospitalized for a few months. Shortly after Ellen's mother was released from the hospital, her relationship with her father, Jack, became volatile. Her father left the home, and then soon after they divorced. Ellen's mother began a relationship with her female partner sometime during the issues with the relationship with her father. Her partner's name is Olive, and they currently live together in Arizona on a ranch. The timing of when the relationship began is unclear, but Ellen feels that her mother betrayed her father. Following the divorce, Ellen continued to live with her mother and Olive in Arizona. Ellen's mother began to notice unhealthy changes in Ellen soon after the divorce and took her into counseling, which was unsuccessful according to Susan. Ellen's father remarried Susan, and for the last 18 months, Ellen has been living with her father, Jack, and her stepmother, Susan, and her stepsister, Kelly. Ellen has a really good relationship with her stepsister. My initial diagnostic impression it would be that Ellen is suffering from some symptoms related to anorexia nervosa, possibly with a comorbidity diagnosis of anxiety, depression, and possibly personality disorder. The following list contains symptoms that are associated with anorexia: refusal to eat, denial of hunger, even when starving, difficulty concentrating, obsessed with body size and shape. In this particular case, Ellen constantly measures the circumference of her arm with her forefinger and her thumb. Skipping meals, making excuses not for eating, eating only certain foods that are considered safe, adopting meal and eating rituals, excessive exercise, and cooking elaborate meals for others but refusing to eat them. Due to the severe nature of anorexia nervosa symptoms, and it would be essential to focus on restoring the client back to her physical health immediately, and then focus on restoring her mental health when she's medically stable. Based on observation, Ellen displays physical signs of poor health, um, looks to be severely underweight. She mentioned that there's absence of menstruation, weight loss is extreme, and she looks very, very thin. Comorbidity diagnosis seems to be appropriate considering Ellen's anxiety and depression. Um, Due to the overlap in symptoms and the blending of features from more than one diagnosis, that's what comorbidity. Ellen's symptoms that are associated with anxiety, depression, and possibly personality disorder could result in a comorbid diagnosis, but the anorexia diagnosis needs immediate attention. I would have Ellen complete the DSM 5 self rated level 1 cross cutting symptom measure for adults to determine the level of her depression and anxiety. To determine the severity of Ellen's eating disorder, I would also request that she fill out the following eating disorder screening questionnaire, which is here on the screen. As a guide, I will also be using the following eating disorder screening that's taken from Therapist's Guide to Clinical Intervention to help evaluate whether or not my initial diagnosis of anorexia nervosa is appropriate for this client. The evaluation form covers the nuance of anorexia nervosa disorder, as well as helping to determine if an additional diagnosis is required. Therapeutic treatment begins with establishing a therapeutic alliance with the client, which is enhanced by empathy, positive regard, reassurance, and support. This builds a working therapeutic relationship to initiate positive change in the client. The primary goals of therapy is for treating anorexia nervosa are to restore the patients to a healthy weight, eating patterns associated with the return of menses and normal ovulation, balanced fluid intake, and realistic perception of body size. Um, all of her physical complications should be treated. Um, enhance the client's motivation to cooperate in the restoration of health and healthy eating patterns and participate in treatment. Another goal would be to terminate the pattern of food restriction behavior and return to normal healthy eating. Provide education regarding healthy nutrition and eating patterns. Help patients reassess and change core dysfunctional cognition, attitudes, motives, conflicts, and feelings related to the disorder. Treat associated psychiatric conditions, including any deficits in mood or impulse regulation. Develop alternate coping strategies to address emotional issues that could lead to relapse of eating disorders. Journal any feelings of stress or diary of thoughts to track. Develop healthy cognition patterns and beliefs about self that could lead to alleviation and help. Enlist family support and provide family counseling and therapy when appropriate, and regular follow up appointments to prevent relapse. The short term goals for Ellen would be to focus on, while working with her, toward restoring her back to her physical health, along with changing her maladaptive thinking and behavior, and honestly describe the pattern of eating including types, amounts, and frequency of food being restricted. Describe any regular use of dysfunctional weight control behaviors. So it would be important for her to complete the eating disorder 3, the EDI 3. The EDI 3 is an effective inventory for assessing the attitude, behaviors, and psychological traits that are related to anorexia nervosa. The EDI 3 has been a reliable and valid tool for evaluation. It's designed to assess and track eating patterns and unhealthy weight loss practices. Cooperate with a complete physical exam. That's something that Ellen would have to do. She also have to cooperate with a visit to her primary care physician and having a dental exam with her dentist. She would need to cooperate with a psychiatrist for the possible need of medication for her anxiety and depression. She would need to take those medications as prescribed and report effectiveness and side effects. Cooperate with admission to an inpatient treatment program if that's needed. I would have her also verbalize an accurate understanding of how eating disorders develop and verbalize an understanding of the goals and rationale for treatment. It'd be good for her to keep a food journal of food consumption, establish regular eating patterns by eating at regular intervals and consuming at least the minimum daily calories necessary to progressively gain weight. Attain and maintain balanced fluids and electrolytes, as well as resuming of her reproductive functions. Identify and develop a hardy of high risk situations for unhealthy eating or weight loss practices. Excuse me, I lost my place there. Identify, challenge, and replace self talk and beliefs that promote the eating disorder. Participate in exposure exercises to build skills in maintaining urges to use maladaptive weight control practices. Ellen will need to complete her homework assignments involving behavioral experiments and or possibly exposure exercises with food. Discuss important people in her life, her past, her present, and describe the quality of those relationships, whether it be good or bad. Learn how to implement problem solving and or conflict resolution skills to resolve interpersonal issues. Implementing relapse prevention strategies for maintaining possible future anxiety symptoms. She would need to state a basis for positive identity that is not based on weight and appearance, but on character traits, relationships, and value. Due to the relationship eating disorder behaviors to physical conditions and consequences, it is important to refer anyone suffering from AN to have a physical evaluation and monitoring if necessary. So that's why I would have requested Ellen to make an appointment with her primary care physician within the week of seeing her. Her weight would seem to be dangerously low, so I would recommend for her to enter a treatment facility that specializes in eating disorders where there's a nutritionist or a dietitian available. The treatment plan formulation serves as a guide for developing goals and for monitoring progress. It is developed specifically to meet the assessed needs of the individual. Treatment plan. It's composed of goals and objectives, which are the focus of treatment. It is best to devise a clear and concise treatment plan for the client. A recent article stated that eating disorders are life-threatening conditions that are challenging to address. However, the primary care setting provides an important opportunity for critical medical and psychosocial intervention. The treatment is most effective when it is multidisciplinary treatment-based approach. I believe that this is the best approach to put together a treatment plan for a client with AN. Anorexia is a multifaceted disease that requires attention from various clinicians. Anorexia clients can exhibit life-threatening symptoms that are in need of close monitoring. In addition to working with their other therapeutic care providers, cognitive behavioral therapy would likely be the best theoretical framework to apply to Ellen's case. The components of CBT have proven to be successful for clients struggling with eating disorders. However, little is known about CBT research on anorexia nervosa. However, but it can influence changes in negative thoughts that are present in anoretic clients. One of the primary goals of CBT is to change the client's irrational thinking. Through various life experiences, specific distorted ideas regarding the self, the world, and the future are learned. These distorted ideas can then create vulnerability to an eating disorder. Vulnerable individuals are often introverted, sensitive, and socially withdrawn. They develop the idea that weight loss will somehow alleviate psychological distress and dysphoria. Functional analysis is the stage of CBT where the individual is learning to identify problematic beliefs or negative self talk. Since negative thoughts and self talk are present for Ellen, this negative self talk by like berating herself in session, I would believe it'd be appropriate to explore a framework which helps her to limit the negative self talk and learn to find her good qualities. Ellen's negative beliefs are not true or helpful for her recovery. So, keeping a brief journal may she can write down all her negative thoughts come up and then replace those thoughts with positive thoughts. By putting her thoughts on trial, she can slow down the process and what she's thinking and feeling. So another stage of CBT would be where she would practice new skills, learn them and practice them, and then apply them to real life situations. Exposure exercises would help Ellen to build skills to manage urges to refuse eating. An example of this would be walking her through eating a piece of pie for dessert and possibly eating with her. There may be intense feelings of anxiety and fear at the thought of eating pie, but Ellen can be encouraged to take steps toward implementing change in her behavior. CBT is helpful because it's breaking down overwhelming circumstances into smaller, more manageable pieces, which allows for insight and connection. Ellen's anorexia symptoms are severe enough to warrant the need to establish a team of professionals to assist her in her care. She also exhibits symptoms of anxiety and depression that are less severe. The following items would need to take place by the next follow-up in a week. It's most important that she follows up with a primary care physician, possibly a gynecologist for physical evaluation. Also, it's suggested that she makes a psychiatric appointment to evaluate the need for anxiety and depression medication. Lastly, she would need to establish care with a nutritionist to guide her in increasing her food intake. So here are my references for my presentation, and thank you guys for listening. Have a great day.